Hi, I'm Dr. Justin, and I wanted to do a video today to talk about opiate use disorder. Opiate addiction, goes by a lot of different names, but basically, what is it when people have a problem with opiates, and how do we think about that kind of from a medical perspective? So, the first thing I think we need to sort of be clear about is that, there's a lot of ways of thinking about opiate use disorder. So if I were a police officer, if I were in law enforcement, if I were maybe a judge, I might think about opiate use disorder as a criminal justice problem or a law enforcement issue. If I were a priest or a pastor, I might think about it as a spiritual problem. And it's not that this is the wrong way to think about it, or these aren't legitimate, or that, quite frankly, that opiate use disorder, opiate addiction doesn't have a component of sort of spiritual pain or of law enforcement implications. But I'm trained as a doctor, and so I really think about it as a medical problem. Okay, so within medicine, there's a whole host of diseases that are what's called chronic relapsing remitting diseases. So what does that mean? Well, chronic means that once you've got it, it doesn't go away. Okay, now that doesn't mean it's always causing you a problem. It doesn't mean that it's running your life or you can't get past it. But once you have this problem, it doesn't really ever go away. Okay, relapsing remitting means that it goes through periods where it gets better, and then it goes through periods where it gets worse. And the goal of any chronic relapsing remitting disease is to get the disease into remission, right? So it's not causing any problems, and then to keep it in remission and to make the flare-ups or the relapses as short as possible, as infrequent as possible, and as little damaging as possible. So other examples of diseases that are chronic relapsing remitting conditions include things like multiple sclerosis, ulcerative colitis, Crohn's disease, asthma. And the goal with all of these diseases is to get the disease into remission and then to keep it there, right? Like, you don't want to be bothered by your asthma all the time. You don't want to be bothered by your multiple sclerosis all the time. You want that disease to kind of be in the background so that you can live your life. And opiate use disorder is really kind of no different than that. And so, that's all great, Doc. How do we do that? Like, how do we get opiate use into the background, into the past, so that it's not causing you problems? And as with any chronic illness, there's really kind of two main treatment modalities or things that we think about when we think about treating this. So one is medications, right? And one is behavior change. And the way that I often think about this is that you're not really going to be successful without both. So the analogy that I bring up here is, let's say someone came to me and they had type 2 diabetes, right? And they said, "Look, doc, what do I got to do to take care of my diabetes?" And I said, "Well, I need you to take this pill to help manage your blood sugars, and I need you to not be drinking, 4 big, huge liters of soda a day," right? And let's say you said to me, "Okay, doc, look, I'm fine to take a pill every day. Like, that doesn't really bother me, but I'm not going to give up my soda." I'd say, "Well, that's okay. You're probably not going to get what you need in terms of results without both taking the pill and giving up the soda. It really takes both of those things in order to successfully treat your diabetes." Let's say say, "Look, doc, like, I'll give up the soda. That'd be really helpful, but I'm not taking your pill." I'd say, "Well, again, that's great, and that's going to help take care of your diabetes, but it's probably not going to be enough, right? You're probably going to have to do both in order to treat your diabetes well." And that's kind of how I think about opiate use disorder, right? So medications for most people are really kind of a needed part of treatment. There's a lot of data that shows that without medications, people have a really hard time being successful with treating opiates and opiate addiction or opiate use. But medications by themselves are probably not enough. And one of the things that I think people struggle with is they think that, oh, well, if I go on medications, then I'll be fine. And that tends not to work particularly well. So it's really medications plus a lot of other behavior change that leads to successful outcomes in opiate use disorder. I'm going to be doing some more videos about what those medication options are and how they work. Make sure you hit the subscribe button so that you can keep on the lookout for those, because there'll be a lot of good information in those. And then I'm also going to be doing a fair number of videos about, what are the other things, what are the other kinds of behavior change and things that go along with a successful recovery, because ultimately what we want is that is that you're doing well with this and that it's not causing you long-term problems. Okay, so hit that subscribe button, and there'll be more videos coming out soon, and I hope this was really helpful for you. All right.